I want the federal government out of medical care. I want people to understand that medical care is not a right. You have a right to your life and your liberty. You ought to have a right to your own money and take care of yourself. But this whole idea that the government is involved and been doing this, most Americans believe that, oh, I have a right to this. I'm entitled to it. In that system, it's not written in the Constitution that the federal government is supposed to pass out medical care. Because if they assume, they claim it's a right to give an individual a service or some good or a house or a job, they have to take it from somebody else. So every time they say it's a right, it's a violation of a right. What you have is a right to your life. So I want to work in the opposite direction. I want to reduce the amount of government, and that's why this private option to me is so important. I'm not going to have it my way because the conditions aren't conducive for it. But if you at least allow people to get out, if they wanted to, you should. Just like people might get upset with public education, but you can't get rid of public education. But what would happen if you could never homeschool and you could never go to a private school? That's what we've done in medicine. You don't have the private option anymore. So I would want to emphasize that. And you could, just so you went in that direction, I would support anything that would go in that direction.
Mr. Paul,